Hi, this is Dr. Eric Thomas talking today about a fairly complex subject, herpes simplex. It can occur either around the face, especially the lips where it's used to be called, maybe still is called, fever blisters or cold sores, or it could occur in the genital area where it can produce a great deal of upset and potentially interfere with relationships. In any event, there are two closely related viruses, herpes simplex type 1, which accounts for the majority, maybe 90% of face cold sores, and there's type 2, which is responsible for the majority, not all, of the genital areas. So these are viruses. They're imperfect, they're incomplete organisms. They require the machinery that your cells provide in order to reproduce. And as I mentioned in one other little video, we're talking about shingles, which is a related herpes infection. These herpes viruses are a little slippery. They're tricky. They can hide. Where do they hide? Well, the nerves serving the face, the genital area, all over, have a coating, waxy coating. Think of it like insulation on the wires to the outside on telephone poles. This insulation protects the nerves from being affected by every pill you take, but unfortunately it also provides a perfect hiding place, a privileged sanctuary, you might say, for the virus. So the virus, once you first encounter it, and you may know it, you may not. You may have a slightly different eruption. It may be more of a sore. Sometimes it's pretty silent. But in any event, the virus then can migrate up into the privileged area where a waxy coating protects us from killing that virus. It may never come back, or it may come back pretty regularly. We don't know why. Presumably your immune system, perhaps the mechanism by which you first obtained the virus and were infected with it. In any event, when the virus wakes up again, it starts to sometimes, not always, produce a burning, a discomfort. You know something's happening. Uh-oh, Freddy's there. And then fairly quickly or immediately, depends on how far away from the surface of the skin the virus is, you develop a sore, a redness, a blister, which could take 2-3 weeks generally to heal on its own. Then it disappears, and then guess what? Could be a year or two, could be a few weeks, it comes back again. It is unfortunately contagious to people who have not already had exposure to the virus, so it requires care, especially with cups, and if you're around little babies and all that, you have to make sure that they are not exposed to it. Is the infection always around the lips or the genital area? No. I've seen it in other areas, in other parts of the body, the legs. One lady who became somewhat disabled had to start using public bathrooms a lot, and somehow she wound up on the back of one leg. Dentists and pathologists, before people used rubber gloves, believe it or not, there was such a time, in being exposed to people's mouths, in the case of dentistry and so forth, would wind up with it elsewhere. There was even something called a prosector's, or maybe a dentist's thumb, where the person would develop herpes simplex from having been exposed to bodily fluids. Not a problem these days with gloves, but just to indicate that when people come in with a lesion, an area that keeps coming back on a regular basis, and it's in an unusual location, the side of the neck perhaps, they often find it difficult to believe that it can be cold sores or fever blisters because of the location, but the history tells it all. So how do we treat it? Well, there are in the old days, things that we call counter-irritants, things that had camphor and so forth in it. They were just cooling, they may have dried up things a bit. They did nothing that I'm aware of for the virus. Now we have antiviral products. Pill form works very well. There are some topical creams, and I'm not a great fan of those. I feel that the virus is best treated the minute that you feel the prodrome, the minute that it starts growing internally. So the pills do get internally. The cream form of these pills is, as they say, available, and if that's what you or your doctor prefers, then by all means, give it a good try. So there are three different families. They're all closely related: famciclovir, acyclovir, valcyclovir. As you can tell from the names, they're not far from one another. The dosage varies. Now, it can be taken a couple of ways. It can be taken intermittently. Uh-oh, here it comes, but it doesn't come that often. Maybe it comes once or twice a year. Pop 5 days, well, it depends on the medicine. The one I use, a few days, usually will suppress it. The full dose might be 5 days. Some people could get away with 3 or 4 days, and it goes into remission. Yeah, it's not killed because we can't get up where the hidden sanctuary is. The medicine doesn't get up into the waxy area of the nerve, but it does get in the skin and in the terminal nerve endings, so it works pretty well. Now, some people, however, for a while in their life may develop it like a rolling infection, like all the time. Like you get rid of one and wow, you may have a week or two and it comes back. For those people, we do sometimes use constant, slightly different dosage again, constant viral suppression with one of those medicines that I mentioned. So what can bring on a flare-up? Well, a lot of times we really don't know. It can be just your immune system, but I have seen it flare up with stimulation of the area. For example, fever blisters. Well, high temperatures can bring it out. Sunburns will produce it, especially on the lips and so forth. I've seen it in one person or two who had some form of physical therapy where they used a nerve stimulator, and there was a flare-up of a herpes virus infection from that. But those are unusual, but can occur. So anyway, I hope that sheds a little light on what I know is a very upsetting condition that can affect relationships between people. Clearly, if you have a partner and it is in the genital area, then a clear discussion, making people aware of what's going on, using a barrier method, which is reasonably effective until things are clarified, may be necessary. Anyway, my heart is with you. I hope that this is helpful to you. This is Dr. Eric Thomas saying goodbye.